So brain aneurysms, this usually happens because of the weakness in the blood vessel wall. So why do they happen? Because there's so many factors for that one. Main thing is family history or genetic factors. So 15-20% of the brain aneurysms do have family history, like various conditions like adult polycystic kidney disease or Marfan syndrome or bicuspid aortic wall association. So in these, there is a weakness in the vessel wall because of the defect in collagen leading to the dilatation of the vessel wall. Apart from this, we also, the other reasons are either infection, where the infection arises from the heart, called infective endocarditis, where the infection goes and sits in the vessel wall leading to the weakness of vessel wall, or it could be because of the injury to the vessel wall, probably associated with head injury. But other conditions like diabetes or hypertension, all these may not directly lead to aneurysm, but they help in the progression of the size of aneurysm leading to the rupture in the future. Once the aneurysm ruptures, or their aneurysms can be of two types, unruptured or ruptured aneurysms. So unruptured aneurysms are incidental findings where when we get a scan and for some other reason we find an aneurysm in the brain. Or the unruptured aneurysms can also present like if it is the aneurysm present on one of the important nerves in the brain, like the visual nerves or the eyeball movement nerves, then they can have visual disturbances or the eyeball movement disturbances. So usually most of aneurysm do rupture and they present severe headache. So like they say it's one of the worst headache they had ever had in their lifetime. Or they can present vomiting or seizure. If when the aneurysm ruptures, there's a bleed into the brain. So the bleed is very minimal, these are symptoms. When the bleed is very massive, which goes into the part of the brain also, then they can have a weakness in one of the hand or leg or speech disturbances, or they can land in a very deep comatose stage. So most of the aneurysms, like around 15-20% of the patients or the population who have the bleed in the aneurysms, they never even reach the hospital because the pressure is so high, they suddenly have death, instant death, which happens in 15-20% of the cases.